Welcome to the Medical Report podcast, where we bring health to your ears. This podcast is brought to you by our sponsors, Care Medical Services, New Life Rehab, Graceful Hands Rehab, and Bantucola. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an attempt to diagnose or treat you. We recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. If anyone in the audience has questions for us individually or about our topic today, please feel free to leave your questions in the chat, and we'll answer it in our Q&A segment later in the show. Also, be sure to like and share this video. We want to feel the love. We are your hosts. I'm Anita. This is Zenzele and Olu. And we also have special guests joining us later today in the show. So let's get started. Today, our topic is about diabetes. More than 34 million people in the U.S. have diabetes, and 5 of them don't even know they have it. More than 88 million U.S. Adults have prediabetes, which is what we would diagnose you with before you are diagnosed with diabetes. More than 84% of them don't know they even have it as well. Diabetes is the 7th leading cause of death in the U.S., so pretty serious topic. CDC approximates that most of those with diabetes have type, and there's also type 2 and gestational diabetes. So with type 1 diabetes, it's a chronic illness characterized by the body's inability to produce insulin due to autoimmune deconstruction of the beta cells in your pancreas. So typically with the onset of type 1, it occurs in children, but it can also occur in adulthood. It's diagnosed by a medical professional after obtaining a fasting glucose test or a glucose tolerance test. High-risk patients can be screened for an anti-islet antibody screening test that could kind of tell us whether or not you have type 1 before they're 10 years old, and again, they can screen at adolescent age. And type 1 diabetes is usually treated with lifelong insulin therapy. With type 2 diabetes, there's a combination of the body resisting insulin action and inadequate insulin secretion and excessive or inappropriate glucagon secretion. All of these can cause that hyperglycemic state in your body, and the way that we screen for that is also with that A1C glucose test, and we do recommend that you're screened for that at age 45 if you have no risk factors. However, if you do have risk factors such as blood pressure over 135/80, if you're overweight with at least one first-degree relative with type 2 diabetes, and elevated blood pressure, have elevated lipid levels, you should be screened for diabetes type 2. Gestational diabetes is that third type that we touched on. It is usually present during pregnancy. It is pregnant, only type of way you can have it when you're pregnant. So gestational diabetes is during pregnancy. After you have your baby, it kind of goes away. It kind of is along the same lines as type 2 diabetes. in that sense. However, if you do end up having gestational diabetes, it does increase your risk of developing type 2 after having your baby. So, long term effects of diabetes can affect your vasculature all through your body. It affects many organs like your eyes, your kidneys, and your heart. So, it's very important that we really understand and know when to look out for um, these look out for diabetes and when we should screen for it and really make sure we're staying on top of it and if we do have diabetes. So that brings us to our first segment. We are going to start with some news with Miss Zenzele. What's a cool topic you
News
want
from
me to?
the hat. Well,
Yeah.
some information you may not have been aware of before, diabetes and hearing loss. So, accumulating evidence points between a link between diabetes and hearing loss. A recent study at the VA National Center for Rehabilitative Auditory Research investigated the link between diabetes severity and hearing. So there's a threshold that you have during your hearing process, and that threshold difference between non-insulin dependent subjects and those with diabetes, there were positive values on the panel indicating hearing is worse among subjects with diabetes compared with this control subjects that did not have diabetes. So just another thing to think about, another thing to consider.
Yeah, and I think that's just it. Like with diabetes in general, that type 1 is so like most of the time type 1 is just autoimmune like we talked about. So it's usually something genetically that we are predisposed to have. And
Right.
so that's just meaning that your body can't really, control the fact that you have diabetes. Diabetes type 2, it comes along either way with diabetes in general, it can affect these organs like we just talked about and then hearing, so your vasculature goes through your whole entire body, as we all know. So it touches all parts
Absolutely.
of us. So
That's
we just really
actually
have to
that's
be
the first
mindful.
time that's the first time I've heard that one. But diabetes impacts your vision. It impacts your circulation in your legs. In my experience in nursing homes, um, most people have diabetes. It seems like in the nursing home settings, and a lot of them are missing limbs. And then you see people who have advanced diabetes, and first it starts with the toe, then it's a foot, then it's up to
Hmm.
the knee, then it's past the knee. But that's interesting. I didn't
Absolutely.
know. I didn't know about hearing loss until you said it today.
Yeah. Yeah. So another area in which I work in with cognition, I tend to find a lot of my patients who have diabetes go into a brain fog. So if it's uncontrolled, then they can have fatigue, they can have confusion, a lot of those type of symptoms. And sometimes if they come into the hospital with those symptoms, they it can be misdiagnosed as something else. So it's something people have to consider that when your blood sugar levels go too low or go too high, it can impact the way that you're thinking, especially your memory.
Yeah. And like you were saying, when people just come into the hospital with these high glucose levels, like a lot of times that's how type 1 diabetes is diagnosed initially. If they never
Right.
had, that diagnosis prior, a lot of times they're going in with diabetic ketoacidosis, which is like really crazy high glucose level. So it's very common to see that in the hospital, unfortunately, that people have to go through a crisis in order for them to realize that that's what they have. So that prevention is so key in just making sure that we're taking care of our bodies.
We have to start watching what we eat. We're going to be eating tomorrow. Tomorrow is Father's Day, and everyone's going to
And
have
it's
their
Juneteenth.
uh, you know,
It is
and it's
Juneteenth,
all
Yeah.
going to be surrounded around food. And we have to be careful. We have to make good choices and think about it in our portion
and you have to
sizes.
exercise, not
Yes.
just diet. You have to exercise
Yes.
too. I always tell
Cardio.
people, yeah, do some cardio. I always tell people if you're not really a runner, just take long walks.
Yes.
Um, Try to do, if you do once or twice a day, you don't have to be out here, lifting weights and
Right.
running to really get those benefits of exercise. Just any kind of activity on a continuous basis is beneficial. I noticed that people can control their blood sugar a little bit better when they've been, they keep a routine of, consistent exercise. But if you're sitting in front of the TV and you consider going up and down your steps, exercise, you probably should do a little bit.
All
Yeah.
right. Just put a nice little mat down, a little yoga mat, do a couple crunches while
Exactly.
you're watching your
Do some
show,
crunches,
you
do
know?
some planks.
Commercial break.
Yeah, exactly. Do some jumping jacks on the commercial breaks.
Right.
Yeah,
Get that little
yeah,
cardio in. Good to
Yeah.
go.
yeah,
Right.
exactly.
Yeah, those are good, easy tips because some people really think that they just don't have time for exercise, and honestly, it's really just about integrating it into your day to style. Just like if you're thinking, I eat 3 meals a day, really.
You just do
I
If you're
love it.
thinking I eat 3 meals a day, that's part of my lifestyle, then say, oh yeah, I need to go work out or just do like go walk around the neighborhood, take the family out. We need to be
Right.
teaching our kids to do the same. We got to
Right.
patch
Right.
these little
Especially
nieces.
that.
Mm-hmm.
Yeah, our young kids,
Yeah,
I take my son every now and again. I take him to the gym and he's only 14 and he's thinking, I'm 14. I don't need to work out. I'm like, yeah, you do. It's because it's a lifestyle.
Exactly. Yeah,
yeah. I like
got to teach
to
them.
take my daughter on walks, not just to burn her energy, but to also use that as my exercise for the day. So we
Mm-hmm.
might walk half a mile, maybe a mile, and she's ready to sleep by the time we get home. And
Yay, winner.
I've burned my calories for the day.
You're right. Just one? Only your calorie?
Right.
One cal-
Calories, calories.
Okay. You said I burn my calories.
I
Right.
burned at least 2 calories.
You're right.
Right.
At least 2 calories, probably more.
All right. So, Olu, do you have a fact of the day for us today?
I do have a fact of the day. Did you know, Anita, a dark patch, or a band, or a velvety skin on the back of your neck, armpit, groin, or elsewhere could mean that you have too much insulin in your blood. This is often a sign of prediabetes, and I'm going to pronounce this correctly. It's called acanthosis nigricans.
Mm-hmm.
Ah.
Oh.
Yeah. Yeah, I could definitely say I've seen some people with that darkish ring on their
See,
neck.
now that I know
I've,
that, I'm going to be on Walmart looking for people with dark
Ex-
necks.
I've been
I
since
mean, it's
since
not
you told
always an
me that.
indicator. Don't get me wrong, but
Right,
some,
right, right.
Since you told
yeah.
me that, though, I have been looking at people's necks, and I've noticed
Yeah.
it a little bit more. And I feel like I want to say something, but then,
Hey, psst, you might be
hey, you
You're
diabetic.
like,
might have
ma'am,
diabetes.
have you gotten your A1C recently?
You might want to go check that blood glucose.
Yeah.
Yeah, I can see the person now. First COVID, now this.
Exactly.
Oh
Okay, so
gosh.
today we wanted to bring on a special guest speaker. So what we know is that it's Dr. Kimmy. She is a registered dietitian with Graceful Hands Rehab. So we're gonna ask Olu to
All
bring
right.
our guest down in.
All right.
Ta-da!
In
I'm
the
looking forward to
meantime,
hearing about this.
yeah, be a fun discussion. I'm really looking forward to hearing more about it. But also, everyone should know that, if you do think that you may have diabetes, signs and symptoms that you may be experiencing, increased thirst, increased appetite, or urinating excessively. Those are signs and symptoms of possible diabetes. And if you want to be screened for diabetes, what your doctor would generally recommend is they'll usually do a hemoglobin A1C is a blood level. It kind of gives us a snapshot of what your glucose runs over the past 3 months. And if it's elevated, or usually the sign is like over 6.5 is the value. If it's
Okay.
elevated, then that would tell us that you are likely diabetic, and that we will treat you based on how high that value is. And then, of course, you're going to want to start implementing. If you're pre-diabetic, they're going to want you to start implementing things like if you were diabetic that may not involve medication, but at least some lifestyle changes. So you would be doing, like we said, exercising, modifying your diet, really just probably trying to do some weight loss if it is type 2 diabetes, because a lot of times it's associated with a higher weight that
Yeah.
So
I was
just
pre-diabetic a couple of years ago, about maybe 4 or 5 years ago, and I watched my diet and checked my numbers, and good today.
yeah,
A
yeah,
little
and
bit of
that's just it.
fitness, a
It's
little bit of
all
diet
about that
change.
prevention. Yeah, it's all about that prevention. So, um, like we talked about, that those risk factors, everyone just really be mindful of that, and just talk to your doctor about it when you go for your yearly checkup. You should be going for a
That's
yearly
it.
checkup, everyone, at least once a year.
Yes. I think our guest is ready.
Yeah.
All right. Hey there. How are
Hi.
you?
I'm fine. How are you?
Good. So thanks for joining us
Afternoon.
today.
Welcome.
You're welcome. I'm happy to be here.
Awesome. So, when managing diabetes, it is imperative we're educated about recommending our daily caloric intake, amounts of carbs, fat, and protein, and all those good fun things in our diet. Instructions on how to divide calories between meals and snacks, and really being involved with nutritionists, dietitian, all that fun stuff. So, can you tell us from your experience as a dietitian more about your general recommendations on the diabetic diet?
All right. Thank you very much. That's a good question. First, I would like to say that it's important for us to know that the plan needs to be individualized. So some individuals not just have diabetes, they have other things as well. So they might have
Mhm.
other diagnoses such as renal disease, such as cardiovascular disease, and some might have normal BMI, some might have on the higher spectrum of the BMI. So all this needs to be individualized to each client. But the general rule of thumb is to keep your carbohydrate consistent throughout the day,
Mhm.
Okay.
picking the right types of carbohydrates. So we know that the simple carbs will drive the blood sugar up. So we want to focus more on complex carbohydrates. And I'll give some examples of complex carbohydrates, like the
Okay.
whole wheat bread.
Mhm.
Oatmeal is a very good one. So oatmeal is really good. Whole wheat
Okay.
pasta, a lot of vegetables, a lot of vegetables. For those that have diabetes, the fruit becomes a little bit complicated because of the simple sugar.
Yeah.
So what I recommend is try to eat fruits that you can eat with the skin. Apples, pears, grapes, blueberries. Those are good choices. And you also mentioned something that we need to match. We need to spread our carbohydrates throughout the day, and then we need to match it with the medication. So depending on the type of
Mhm.
medication that the patient is on, that will determine how many carbohydrate servings we're going to give per meal. And like I said, it's
Okay.
individualized. We need to estimate the patient's
Yes.
calories, decide, work with the patient, and then based on clinical judgment, decide how much of the calories is going to be coming from carbohydrates. We divide that
So,
into
really, a good
servings.
focus, you would say, with diabetes is those carbs, just making sure that they're eating more of the
Exactly.
complex versus the simple.
The
Okay.
complex. Right.
Yeah, that's good
Right.
Mhm.
information because a lot of times people think if I just stay away from the sugar and don't eat any carbs.
Please don't do that.
Yeah.
I always tell people don't do that. You end up coming. I've had patients come back with very high blood sugar and they tell me they don't eat
Mhm.
any carbs. And they're right. Our body is going to make glucose regardless
Yeah.
of if we give it carbohydrates or not. So please just being mindful of the type of carbohydrates is
Okay.
very important. And then having
So
those snacks in between meals is very important too. So we can keep that blood sugar controlled throughout the day. We don't
Control.
want spikes, right? We want to keep it level throughout the day.
so try to stay away from breakfast, lunch, and dinner. Just those simple large meals.
Um, no, we want breakfast, one lunch, one dinner, but we want snacks in between them. So
Yeah.
a snack before lunch and then a snack after dinner. So we're gonna
What
have a
types of
long period
snacks
of
do you
fasting.
recommend?
So cottage cheese is
Cottage
good.
cheese.
Yes,
Yay, that's what I use.
you can do the low sodium cheese and crackers. But again, remember
Oh,
we have to count the carbohydrate. One carbohydrate seven and one seven of protein. Yogurt is a very good one too. Peanut butter jelly sandwich. But this is
oh, who would
not
have thought?
not the way
My husband loves
not the way you
PBJs.
put the peanut butter on there. So we have to measure it.
Oh,
So yes, we
That's
have to
no
measure
fun.
low sodium peanut butter. No more than 1 tablespoon on one slice of whole wheat bread and the low sugar jelly. No more than 1 tablespoon
Ah,
is allowed. Yes, we have to be mindful. We have
Low
to check
sugar
all
jelly.
the the nutrition of what we're using.
I can
When,
definitely see
when a
our people
diabetic,
having peanut. Go ahead.
go ahead.
I was just gonna say I could definitely see our people having a peanut butter and jelly sandwich and sliding that stuff on there,
I
saying I'm
typically
being
don't tell
healthy.
them. I actually don't tell clients that do peanut butter jelly sandwich, but some of them tell you that that's the snack I like. Oh well, you gave me, I don't like this. And then I work with
Mhm.
you. I then we go through portion sizes.
Mm-hmm.
So you have to measure and make sure that we stay within the calorie needs for the day, within the carbohydrates counts for the day as well.
So when a diabetic is looking at the nutrition facts on the side of a label, what carbohydrate, I guess, amount should they be trying to stay under? Is there like a range?
So let's use a percentage for that. So
Yeah.
I tell people I use the 5 to 20% rule. So on the label we have the percentage. So for the good nutrients, let's try to stay about 20%. And the good nutrient is going to be our fiber,
Yeah.
protein, those minerals and vitamins. We want to stay above 20%. And then for sugar, simple sugars, for saturated fatty acids, cholesterol, we want to stay less than 5%. Again, looking at the label, it depends on if that's your main meal or if it's the snack.
Right.
Knowing how to count the carbohydrate will now be very important when you're looking at the label. But I say that for a snack, try not to do more than 15 grams per snack. 15
Okay.
grams of
Okay.
carbohydrate per snack. For your meal, you don't want to if you're a female, you want to stay between 3 to 4 servings of carbohydrate, which is 60 grams per meal. For male, it is 4 to 5 servings, which is 60 to 75 grams of carbohydrate per meal.
Okay. So, can you give us some words of advice for our diabetic patients for long term success when they're starting out on a diabetic diet? So, like, somebody comes into you and, like, they just told me I have diabetes, and then
Okay.
they're not quite sure how to just really get started, and then actually that motivation, because, it's hard to change your diet.
Right, it
That's
is.
Right.
when you're losing
It is.
weight. That's the hardest part is like really being consistent with that diet.
Right.
Absolutely.
So, what are your, I guess, some pearls of wisdom?
So the first thing I tell them is it's not the end of the world and it can be managed. You don't have to change your diet completely. We just need to be mindful of what you're eating and set realistic goals. Some people come to me and tell me I need to lose this weight by next week. Those are not realistic goals. We need to set
No.
realistic goals. We need to set our short term goals and our long term goals. You come in, your A1C is 14. We can't get it back to 7 by next month. It's not just
Right.
possible.
Right.
We need to start from
14.
we need to start from 13, right? So let's
Yeah.
say we work towards that. Then we achieved that. Okay, so let's bring it now to 10. And physical activity is very very important in managing blood glucose. So it's part of the recommendation. Like Olu said, you all said, you want to do moderate exercise. It doesn't have to be anything rigorous. It don't have to be how you're lifting weight. So
Right.
just getting in the 45 minutes, 60 minutes physical activity every day is going to be good.
Wow.
It's good enough. Yeah. Long work
So
and
there's a
being
lot of people.
accountable.
Yeah, there's a lot of people who are really busy, right? And they might have their own business and they go to work, or they have children and they're feeding the kids and things like that. So is it possible to maintain it with just your diet maybe for some time, or is exercise really that important
E-
to it?
Exercise is really that important to it because, like you said, type 2 diabetes can be caused by insulin resistance or insufficiency of the pancreas. So that insulin
Right.
resistance can only be improved with physical activity.
Mm-hmm. I agree.
Okay.
I mean, even with type 1 diabetes, still needing to be and mindful of that exercise. It's
Right.
just your body in general needs to be fit. Like your cardiovascular system needs to stay healthy.
Right.
So it's a very important for our long-term health.
So what I recommend for busy individuals is every 1 hour I try to get up and do 5 minutes.
Okay.
Every 1 hour I do 5 minutes. I'm quite busy too all
Yeah.
day. I'm working and but I still
Absolutely.
try to get 40 minutes to 60 minutes by being mindful, getting up every hour, do 5 minutes. By the end of the day, by the end of 8 hours, you've done 40 minutes of exercise.
So you can break it up. It
You
doesn't
can
have to
break it
be,
up
I have to find an
exactly.
hour a day or 30 minutes and it has to be at this time. You can say, hey, I've got 5 here, I've got 10 there.
Exactly. The other day, I was thinking to myself, how cool will it be if I can get like a cycling under my desk, right? And then someone
Yeah,
told me that it actually
Right.
exists. You can get one, and
it
That's
does.
the
yes,
thing. Yeah.
Yeah,
you're getting
They
in
have the
inside
little
when you're
pedals
physically
now.
done. So
And they even have those
yes,
yeah.
treadmills.
so
Jump on
yeah,
Amazon, you'll find it.
yes, yes.
So true.
Right. So
So
there are
true.
ways. It's just getting the knowledge and being motivated.
Yeah. All right. So we're gonna take some questions from our audience now. So if you guys have questions that you'd like answered, go ahead and put them up here.
So, how long have you been in this working with diabetes and how did you kind of move into that area?
All right. So I've been doing this my whole life, but I became credentialed 3 years, 4 years ago, 4 years ago. Because I'm originally from Nigeria, and growing up, you really don't need to be a registered dietitian to practice, right? It's just something I've always been interested in. Diet. I try to grow a lot of my food too, and then I educate my family and friends on how to eat better, being awesome with the types of food that you're eating. But I've been a registered dietitian for 4 years. I've been practicing for over 4 years now.
Right. Yeah, that's something to really think about getting our kids into. My son likes gardening, so it's a good opportunity to do something with your kids. Yeah.
I was telling my husband about how, being out there gardening actually helps with depression. It's a good workout too. So
Yeah.
I think
Is
we
the
have a
Atkins
question,
diet
Nita.
good for diabetics?
so that is controversial. As a dietitian, we only we only recommend evidence based diet prescription. And Atkins diet is more of protein and less of the carb. I remember that
Hmm.
I said that we need carbs
Yeah.
to survive. Our blood cells need carbs. Our brain cells need carbohydrate. So I wouldn't recommend Atkins diet for my patients that have diabetes.
Okay.
There's something called the acceptable macronutrient distribution range. And for carbohydrate, at least 45% of your calories should be coming from carbohydrate. And that's the least I'm gonna go with any patient.
Okay.
Yeah.
45% of your total calories coming from carbohydrate. And Atkins diet is like 10% of your total
It's
calories,
less.
50% of
Yeah.
your total calories. So while
It's
you
like
might not see
crazy.
any implications right now of being on the Atkins diet when you have diabetes, there might be long term effects of it.
Yeah, that's true.
So, as far as over the counter, we have a question from Tessa Garcia Sandoval. And over the counter supplements or any natural supplements you can think of that could aid in helping control diabetes?
So I don't personally recommend them, but I know that there are some that people have said. For instance, cinnamon. There's someone that told me that they've taken cinnamon before, like cinnamon capsules,
Okay.
that have helped with that. I don't really necessarily know if they're really the culprit of actually doing anything, but
Right.
Right.
So
I've had some people swear by those.
with the supplement, we need to be careful. What is the dosage and where are they coming from? Are they actually really clean? So I agree with you. I don't recommend supplement for diabetes. I
Yeah.
would recommend multivitamins and minerals if you're deficient in them, or if I know
Right.
that you're not getting them from your diet. But when it
Hmm.
comes to those herbs, I would say that we want to be careful. You want to see a medical doctor because it might be interacting with your medication.
Exactly. And
That
that's
was my
very
point right
common
there.
happens.
So
Yeah.
we want to
It's
be
very
careful with
common.
those herbs.
A lot of people will come to the doctor's office and bring their list of medicines, but they don't even include the ones that they just take like supplements. But those are important
Right.
to
Right.
include
Or
too.
I'm a detective when it comes to that. I always
Yeah.
ask. Even I
I'm
would
the
ask,
same
how
way.
much garlic do you use to cook? Because at some
Uh-huh.
point, I believe that I was using pharmacological doses of garlic to cook. That's how much I love garlic. I love
Yeah.
Yeah.
garlic so much. So I would ask you,
Yeah.
how much garlic, how much ginger do you use to cook?
Mhm.
Mm-hmm. Yeah, I'll read a med list in a minute. You know, those medications, they impact your thinking. Like I was saying earlier with the with the diabetic fog that you have, the brain fog that you have, and I'll look at some of it, but like you said, they don't have the supplements on there.
Right, right.
So it's important to let people know if you have supplements you're taking and what they can, and how you share that with them. Can skinny people get diabetes?
So type, yeah,
Yes.
I've seen people with low BMI with
Yeah.
hypoglycemia. Yes, they can. Family history plays a role. Lifestyle
Yeah,
factors
that's
plays a
that type
role.
1.
Genetics,
Mhm.
yes, plays a role. So yes, we've seen that. Diabetes is
Yeah,
not
type
just
1
for those that have
diabetics.
high.
Yeah. Type 1 diabetics are usually the ones that are the ones
Skinny.
that you will see that are skinny but have
Yeah,
diabetes. It's
right,
just because
Okay.
they're genetically predisposed to having type 1 diabetes. So,
right. I would like to add to the answer that I gave for the Atkins diet. So just like the way we have high blood sugar, we can also have low blood sugar, which
Okay.
could lead to coma, which could lead to some,
other
detrimental.
things. Mhm.
So we need a level of glucose in the
Yes.
blood to be
Hmm.
functioning. We don't want to keep it less than 70 milligrams per day. So checking the blood glucose daily is very important. I recommend 3 to 4 times a day. Checking your blood glucose is good to check it before and after meals. If you work out, if you do rigorous activity, then you want to check it before you
Yeah.
work out and after you work out. And then for those that do work out, you want to be mindful of your snacks before working out. Remember, when you work out, your glucose, your insulin function is going to increase. So you want to provide carbohydrates for that
To help
activity as
supplement
well.
that. Yeah.
Yeah,
Another thing too is some people take serotonin, and you know we know too much blood sugar can increase serotonin and neurotransmitters in the brain.
right.
Um, these chemicals normally have a positive effect on nerve cells and brain function, but too much serotonin and increased neurotransmitters can have an opposite effect.
Exactly.
So, you know, if you're taking serotonin supplements for sleep or something like that,
Or
just
depression.
keep
Yeah.
that, yeah, keep that in mind.
Is that something you can get from eating type 1? So type 1 diabetes is not. So with type 1
Mhm.
diabetes, it's what we consider to be more genetic. There are people that don't necessarily get type 1 diabetes until later in life, but it's usually they triggered by someone that's still genetically predisposed, but may have had a viral illness that caused that trip to actually end up happening. Um, with type 2 diabetes, that's more so the one that you're going to find ends up being the one more associated with weight gain, and then your insulin is just not sufficient for your body. So,
Just a side note, if you have a parent or a grandmother that is diabetic, you know, look out for some symptoms: fatigue, irritability, dizziness, confusion, memory loss, difficulty problem solving, finding the right words to concentrate. If they're presenting with some of these symptoms, their levels might be off. You know, you might want to talk to them and say, "Hey, how have you been working with your diabetes? How's your eating?" And check in on them.
yep. I think that kind of answered Chris's question that he just posted there. He said, "What were the symptoms and signs?"
Yeah,
Lucia says, in 2021, during a routine physical, my PCP asked me, "How do you take your insulin?" I informed him that I'm not a diabetic and I don't take any insulin. He responded saying, "I'm reading the lab results of a," I can't see the rest.
diabetic. reading the lab results of a diabetic. If you're one already, you'll be, if you're not already, you'll be one soon if you don't change your eating habits. Does this make me a pre-diabetic?
So if he's saying that your levels are high, it's possible, but I think that it's only I can only I can't exactly say what it was because I wasn't there at the time.
Right.
But we can only just go off it's possible. But if they would need to do an A1C more than likely to really kind of tell if you're a pre-diabetic versus diabetic. So
Okay. So if I guess if they're saying if you're not one now, you may be soon. That's almost like saying pre-diabetic, because I know going to my PCP, she believes in um, diagnosing someone as pre-diabetic. I've talked to other PCPs. They're saying, "Oh, there's no such thing. Either you were diabetic or you're not."
I think when people use the term pre-diabetic, it kind of at least will get the patient in the mindset of I need to start being proactive about my health before it becomes a reality.
Right.
Um, so if you're pre-diabetic, that just means that you're right there on that cusp, and you really need to start getting serious about your health, really making changes in your diet and your exercise patterns to try to prevent that type 2 diabetes,
Mm.
if at all possible. My HDL and LDL levels have dropped since. I'm guessing some changes have been made. If
Right.
yes, that's good.
Hey.
That's good.
Mm.
Always progress. But okay, guys. Well, thank you guys for tuning into our show. We really appreciate you guys. We will be back again in another 2 weeks. Just look here on on our page of the medical report on Facebook. Again, we just want to let you know to tune in next time. We'll see you guys.
Two
Bye.
weeks. See you then.